Good morning and welcome to 2020 Mom's 13th Annual Maternal Mental Health Forum. My name is Priya Bathija and I'm the founder and CEO of New Health. I'm also proud to be a member of the 2020 Mom Board of Directors and to serve as the incoming board chair. On behalf of our current board chair, Britt Newton, and the entire 2020 Mom Board of Directors, we are so glad that you have joined us today. And we hope that you are ready for the incredible speaker lineup that you will see this week. We also have some pretty amazing colleagues in attendance. We have over 625 attendees from 46 states and over 10 webcast sites. This includes the Colorado Department of Public Health, who has been webcasting this program for over 5 years now. We also have a new site at Postpartum Support in Virginia. Before we get started, I'd like to share some updates from the 2020 Mom Board. In 2021, our board approved a new strategic plan. We know the field of maternal mental health is growing, and we wanted to pause to make sure that 2020 Mom was focused on delivering services that aligned with our unique strengths and maximized our ability to impact those that we serve. Those strengths include our understanding of the complex healthcare delivery system, including healthcare payment, our cross-sector relationships between business, government, and nonprofits, and our creativity. We have a long history of seeing barriers and connecting the dots to solve complex problems within the mental health and maternal health sectors. We also had an opportunity to redefine who we serve as an organization. There is no question, mothers will always be the center of what we do. But we also want to support the people surrounding mothers, the people who can implement change in maternal mental health care. We call them our 4 Ps. First, our payers, including employers, Medicaid agencies, and insurers. Second, providers. That includes the OBGYNs who serve as the medical home during the perinatal period, and hospitals and healthcare systems. Third, are policymakers, including state and federal lawmakers and government agencies. And finally, our many partners, which include national nonprofit organizations, philanthropic funders, and community-based nonprofit organizations. The audience today is filled with those representing these 4 Ps. We are thrilled to have you and so many other advocates with us. And as I mentioned, we have a great program in store for you. One last thing before we get on with that program. You may have heard that 2020 Mom is changing our name. As we aligned our strengths to our strategic plan and better defined our audience, we determined it was time to have a name that clearly states what 2020 Mom does and that can take us into our next chapter. We'll be sharing more about our name and new branding this Friday at the forum. Now, to help us officially start the forum, I have the great pleasure of introducing our founder and executive director, Joy Burkhart. Joy is a social entrepreneur with deep experience in the healthcare delivery system. In addition to founding 2020 Mom, Mom Congress, and the National Coalition for Maternal Mental Health, she spent 24 years working for the Fortune 50 health insurance company, Cigna. At Cigna, Joy specialized in quality improvement and innovation, compliance implementation and oversight, and supported cross-functional teams in delivering outcomes. She serves on several boards and committees, including Stanford University's California Maternal Quality Care Collaborative, Executive Committee, and its Board of Directors. She is also an advisor on several Patient-Centered Outcomes Research Institute projects and serves as a Medicaid MACPAC Core Set committee member. Joy has also been recognized with several awards, most notably the American Public Health Association's Maternal Child Health Advocate of the Year Award and the federal government's Emerging Leader Award from Health and Human Services Office of Women's Health. Without further ado, Joy, I'll turn it over to you.
Well, thank you, Priya, and welcome everyone. Welcome back to those of you who've been attending the forum for years and wouldn't dare miss the action. And also welcome to those of you who are attending for the first time. Once you attend a forum, we say you become part of the forum family of change agents. We are so glad that you're all here. I wanted to start this year by acknowledging the native lands that I live on. Every year at the forum, we work to lift up marginalized populations and address health inequities. Tomorrow morning, we're holding a fireside chat with several leaders in the Native American community and the CDC. To acknowledge the harms that have been done to Native people, we invite you to learn if you live on Native lands and to acknowledge when you do. You can learn more on the rotating slides and also in the Whova app about how to learn which Native lands you live on. Here's my Native land acknowledgement. Hello, my name is Joy Burkhard, and I acknowledge that I reside on the lands first occupied by the Tataviam. The Tataviam is a Serrano word meaning people facing the sun. Our theme this year at the forum is planting seeds and reaping rewards. The theme helps us think about investing time and resources into developing policies for healthcare systems change and community support and social policy change. All of that to reap the rewards of healthy and thriving mothers, allowing for healthy and thriving children and families. We will explore these concepts and policies throughout our 3 days together, with a special focus today on how children can be helped or harmed by maternal mental health. A lot has happened since we were here together at the forum last year. And as we begin the program today, I felt it was important to take stock and share a few of the most significant highlights. So let me get into them. Number one, the National Maternal Mental Health Hotline for Mothers and Families was launched. This is an effort that was led by our colleagues at the Maternal Mental Health Leadership Alliance and is a line staffed by our partners and colleagues at Postpartum Support International. Number two, the U.S. maternal mental health screening rates were released for the very first time. They're called HEDIS rates. And the need for a HEDIS measure was noted in the California State Strategic Plan for Maternal Mental Health. And we're so excited that the funding was developed by the Zoma Foundation and the California Healthcare Foundation to make those HEDIS measures a reality. Not surprisingly, screening in both pregnancy and the postpartum period was reported at less than 20%, and only half of those who were screened positive received any type of follow-up. You can learn more about those HEDIS and screening rates on our website. Number three, the CDC released updates on maternal mortality, including sharing its latest pregnancy-related maternal mortality report at the Mom Congress Congressional Briefing this September, noting that maternal mental health conditions, inclusive of overdoses, were the #1 cause of death. The CDC announced just last week that maternal mortality rates continue to rise and that Black and Native American and Alaskan Native American women continue to die at 2 to 3 times more than white women. Number four, the tragedy involving Lindsay Clancy in Massachusetts brought unprecedented recent attention to the most life-threatening of all maternal mental health disorders, postpartum psychosis. Number five, Roe v. Wade was overturned in the US, and still the US has no infrastructure in place to substantially support mothers and children, no universal paid family leave or childcare system. And number six, there is still hope, and the Triumph for New Moms Act, a bill that was championed by 2020 Mom, was signed into law in December. It will create a task force within the federal government to study gaps in maternal mental health care and create a national strategic plan, including providing recommendations to governors. The Triumph Act will be implemented in part by the Health and Human Services Agency. And to that end, it's my pleasure to introduce Rachel Pryor to make opening remarks on behalf of the agency. Rachel serves as a counselor to the Secretary for Health Policy at the U.S. Department of Health and Human Services. Rachel, welcome.
Thank you so much. And I'm so happy to be here with you all today. It's really a privilege, particularly on an issue that this administration feels so passionate about, as well as me personally, right? I think it's hard to not have a personal story with this topic. I think for a lot of us, either somebody that we know or love or ourselves, in my case, I have all the advantages in this world that a person could ever have. And I had a really hard time, when I had my first child, and candidly had a hard time when I had my second child, but at least I had a sense of what was going on a little bit better the second time around. And, again, every advantage under the sun. And I still really struggled with postpartum depression and anxiety. And it really has stuck with me how much that experience can be traumatic. And if you didn't have the resources that you needed, didn't have the support that you needed, how much lonelier a place we would be in. I think to that end, this administration is deeply, deeply committed to addressing not just our maternal mortality crisis, but our crisis around mental health, particularly for our moms. And I want to talk about a couple things, because I do think that the mental health piece of this, we all talk a big talk about mental health is health, but we have a little bit more work to do to walk the walk. And I think that's something, the more that we can talk about it, the more that we can focus on, your mental health as a perinatal, pregnant or postpartum woman, how important that is, the more that helps us advance the ball forward and keep the issue front and center as something that we need to address. This administration is proud of a lot of things we do. I literally am looking at a list in front of me in preparation for this speaking event of all the things that we've done. And I want to mention a couple of them, because I think, like I said, we have longer to go to walk the walk, but we are ready and willing to sort of put our boots on and start walking. I have to mention at the top, I'm a former deputy director of Virginia Medicaid. I would be remiss if I did not talk about the importance of coverage in all of this. You don't really have access to services unless you have health insurance coverage first. To that end, we are so proud that we are at 29 states and Washington, D.C. So far that have been approved for postpartum coverage extension, meaning that that woman ensures that she does not have an interruption in her coverage in any way for a full year after birth. I feel very deeply about that policy, because I think that the worst thing that could happen is at a really critical moment in time, you truly don't have access to mental health services. You don't have access to care for yourself in any way, because you don't have access to coverage. To that end, also, we're really proud of what we've been able to accomplish as we near the 13th anniversary of the Affordable Care Act. We are very proud of over 16 million plan selections this time around. With this administration has hit the lowest rate of uninsured in the history of our nation. We are proud of that. We are going to work hard to maintain that. I bring that up again because I don't really believe that anyone can have true access to care unless they have access to health insurance coverage that protects them from out-of-pocket costs. We are also really focused on working across our department. The secretary, when he was confirmed, and I will say our secretary, while I think a lot of people know he's a former attorney general, what a lot of people don't realize is that his wife is a high-risk OBGYN. Dr. Reyes, has really shaped our secretary and shaped his commitment to maternal health. And that was a top priority for him coming in the door. Behavioral health was also elevated as a top priority for his department. And so those two issues fit really nicely together. Our SAMHSA and OASH teams and others are working hard to hopefully soon, fingers crossed, roll out that maternal mental health task force that that Congress recently authorized. We're couldn't be more thrilled to be able to do that. I think that is going to give folks a voice in a way and a spotlight of attention onto an issue that I think we talk a lot about maternal health. We don't talk as much, as somebody who's a former social worker, I like seeing the focus on mental health. I think the impact on maternal health is pretty big, and I think we can all acknowledge that. And so we're hoping to really take this year and focus hard on that intersection between maternal health and mental health. We've got, I feel like I could go on some of our accomplishments, but I will say that I think from our perspective, we're really trying to address this across every possible operating division. So a lot of my role, and people are always like, what does a counselor do? But a lot of my role is to work with all 11 of our agencies, HRSA, CMS, SAMHSA, all of them, and the White House to advance our strategic direction on mental health. And maternal health is certainly a part of that. And so we've got, whether it's IHS and thinking about our AIAN population, whether it's our SAMHSA focus both on the mental health and substance use side. We just released new grants around that will reduce stigma for women that are suffering or using drugs while they're pregnant, and making sure that they can access that care and that we can support them through postpartum, whether it's through our HHS overdose prevention strategy, whether it's through our new HHS roadmap to integrate mental health with physical health. We've tried to have a focus on maternal mental health all the way through, because nothing could be more important than keeping our birthing parents healthy, both during and after pregnancy. I will stop there because I think, and I told folks as we were joining this session, I said they gave me five pages of talking points. Like, I can't talk for 30 minutes about everything that we've done here. But we are really excited to work with you all. We see events like this as something that helps really keep the issue, as I mentioned, on the forefront. The issues that come to my attention, that I pay attention to all day, are when I hear from outside stakeholders, or our agencies are hearing from outside stakeholders, and people are really, have the issue in front of their faces, so to speak. And so I really encourage folks to keep that issue front and center for all of us, particularly as we go into this year with the president's focus on and unity agenda on mental health. Thank you so much. And I was really thrilled to be here with you all today.
Thank you so much, Rachel. We're really grateful for the leadership of the Biden administration, and we'll be hearing from some of the agencies that Rachel alluded to during our 3 days together. All right, thank you again. And before we officially begin the program, we wish to provide our sincerest gratitude to our sponsors of the forum, starting with a video from one of our sponsors, a new sponsor, Organon.
For far too long, the health of women has been underfunded, under-researched, and underserved. And it's astounding that 50% of all pregnancies are unintended and preventing many women and girls from achieving their full promise. That's why Organon is launching a new initiative to accelerate progress in reducing unplanned pregnancies around the world in places with the greatest need. We are expanding our existing investments with new programs and partnerships focused on education, access, advocacy, and innovation. Working together, we can help secure her promise and a more equitable future.
Well, we thank Organon, and we also wish to thank our other sponsors of this year's forum. We want to thank our first philanthropic funder and sponsor, the Zoma Foundation, also the California Healthcare Foundation, who was instrumental in funding change here in California and beyond, and to our longest standing forum sponsor, Cigna Healthcare, Sage Therapeutics, who you will hear from tomorrow, and also Breathe Biosciences, who is developing new treatments for maternal mental health, and then finally the Bacchus Family Fund. Thank you to all of you for making this event possible. Next, I wanted to remind you to post your favorite moments and quotes on social media over the next 3 days. 3 people or organizations who post the most engaging posts will receive complimentary passes to next year's forum. You can find our handles here on the slide and also the hashtags below, including maternal mental health. All right, by now you all know we're using Whova as the event platform, which integrates into Zoom. For the main stage, you can stay right here in this room and it will flow continuously through the regional networking sessions, which happen at 2 p.m. today. You can join your networking session at 2 p.m. from the Whova app or desktop platform. We want to hear from you during this event. You can use the chat feature in Whova during each session. It's at the right side of your viewing window. Thank you, Josh, our tech, for sharing where that is in the viewing window. Questions can be posed to presenters throughout our 3 days at any time using the Q&A section for each session in Whova. And questions will be answered in Whova throughout the week rather than during the live sessions. And a final announcement about Whova. Did you know you can host a meetup anytime over the next 3 days or 3 months by posting a meetup in Whova for any topic you wish, or even to convene as a state if you want to bring your state leaders together. This year, like in prior years, we have the good fortune to have Ken Tackett serve as a graphic illustrator for us. He's new to us this year, and we've loved having graphic illustration throughout the event. He'll be illustrating key points from our main stage sessions, and his live video will be shared on screen occasionally throughout our time together. At the end of the forum, those illustrations will be provided on our website, and you'll hear about them through our e-news. And now, without further ado, it's time to start our program. We were given a really wise advice from one of the original champions of maternal mental health, a double board certified pediatrician and psychiatrist, to always start with a story. I'd like to now introduce Gina Arias from Moms Rising to introduce the first of 2 stories you will hear about this week at the forum. Gina will also tell you more about the Moms Rising Maternal Mental Health Storybook, an important new resource for the field. Gina?
Good morning or good afternoon, wherever you may be. Thank you for inviting me to participate in this important event. Before introducing our next speaker, I'd like to share a little bit about Moms Rising. We are a national on-the-ground and online multicultural organization with more than 1 million members and over 100 aligned organizations. We're also a media outlet with over 3,000 bloggers. We help to bring the voices and real-world experiences of women and mothers straight to local, state, and national leaders, and also to amplify women's voices and policy issues in the national dialogue and in the media across all platforms: radio, print, blogs, social media, etc. We take on the most critical issues facing women, mothers, and families by educating the public and mobilizing massive grassroots actions in the areas of youth and family justice, immigration, gun safety, healthcare, and several other areas, including maternal justice. Our maternal justice campaigns includes a focus on reproductive justice, also the maternal mortality crisis, and of course, what we're here to discuss at this forum and learn about, which is maternal mental health. Moms Rising has been instrumental in helping to raise the voices of women struggling with maternal mental health issues, primarily through the work that we do with our members, who are often the fiercest advocates. In collaboration with our members, last year, we were able to publish a maternal mental health storybook, which highlights the postpartum experiences of women and their families. And the stories that were submitted and are in the storybook are from people from all 50 states. So we want to encourage you to use this resource, which is available in the handout for this session. Also in the handout is the tool that we're using to collect even more maternal mental health stories. So we'd like to encourage you to please share both of those widely. One Moms Rising member whose story was highlighted in the storybook will be sharing her postpartum mental health struggles momentarily. Her name is Cassie Williams. She's a writer, a licensing specialist, and a mother from Michigan. Let's show her some virtual love as she bravely and generously shares her story with us. Thank you.
It was the 9th day of my son's life when I slipped into the abyss of postpartum depression. I remember the moment it happened, though at the time I didn't know exactly what had occurred. My husband and I were up in the night attempting to comfort our newborn through one of his seemingly endless crying jags. I had not spent much time around babies prior to having my own, so I didn't know that the cry of a newborn is a sound akin to a dying transmission screeching, except that it feels like you're inside the transmission. So on this night, my husband and I had already spent an hour or so trying various techniques to comfort our son. We swaddled and rocked him. We burped him. I gave him my breast. We held him like a football. We rotated his legs in bicycle kicks, hoping to dislodge gas or poop or anything. Nothing worked. I don't remember the technique my husband was attempting at the time, but I had had enough. I snatched my son from his arms and through gritted teeth growled, "Stop it!" right in his squalling, alien-looking face. My son stopped crying for a moment out of fear because I had scared him, and then I crumbled. That moment seemed to confirm my every anxiety over the 9 days preceding it. I was a bad mother. I could not be trusted to take care of my child. I had made a terrible mistake in having a baby, and I was going to ruin both of our lives. What I didn't realize was that in the little over a week I'd been a mother, I had been clinging to the edge of a precipice. I was in constant pain from an unplanned C-section and a cluster feeding infant. I hadn't slept more than 3 hours in a stretch. My anxiety and my obsessive compulsive disorder, dormant since my teen years, had ratcheted up to levels that I did not know were possible. The next few days were some of the darkest of my life. I convinced myself that in that moment I had shaken my baby and brain damaged him. I cried constantly. I begged my mother not to leave, begged my husband not to return to work. I looked at my baby and I did not feel love, only terror. The day before my husband was set to go back to work, I finally called my OBGYN practice. The practice was made up of 8 women, 4 doctors and 4 midwives. All but one had children of their own. During my pregnancy, I had attended one of their functions where each doctor and midwife stood up and spoke about her own birth experience. A couple had described postpartum depression. When I called, an available doctor was the only one in the practice that I hadn't had much contact with, and I was really nervous to tell her what was going on. "I'm really scared and upset," I told her. "I'm scared I'm going to hurt my baby. I don't want to, but I'm scared something is going to happen." "Are you afraid to be alone with your baby?" she asked. "Yes." I waited for her response. She sighed. "Oh, honey, it's so hard," she said. "Every one of us wishes we could just set that baby on the porch so we could get a good night's sleep." I chuckled and felt a little bit more at ease. At least she didn't think I was crazy. "I see in your chart that you were previously diagnosed with obsessive compulsive disorder. Were you ever put on medication for that?" I explained that I had been, but it had made me feel sort of numb, which I didn't like. "My dear, numb is going to be better than what you're feeling now. Numb might be our best case scenario for the time being." She prescribed me that same medication I'd been prescribed as a teen. Within 2 weeks, I felt an incredible difference. Far from feeling numb, I just felt normal. My older cousins and aunts sent me words of encouragement and tips for getting my fussy baby to calm down. And instead of rejecting their advice and my dark mind thinking they won't understand, I was able to receive that information and use it. I quickly grew to love my baby. I accepted his pediatrician's warning that I wasn't producing enough milk and supplemented his feedings with formula. all of this made my life exponentially better and easier, and it's because I was able to accept help. As the weeks continued, I faced struggles. I was forced to choose between returning to my career and accepting part-time work to avoid childcare costs. I had to navigate the state-funded healthcare system to get coverage for myself and my baby. And the only reason I was able to push through these problems and find solutions is because I had gained mental clarity and emotional stability. I had been treated for the disease that I had. I found that once my hormonal cycles returned to normal, I was able to wean off the antidepressants and I felt like my old self again. I don't underestimate how blessed I was to have a healthcare provider who understood my struggles, and I understand why so many women are frightened to speak up about their postpartum anxiety and depression. I'm grateful that I got the help I needed, and I know that it saved my life.
Thank you so much, Cassie and Gina. We will have a chance to unpack Cassie's story just a little bit more on Friday when we hear from the American College of Obstetrics and Gynecology about the just released Alliance for Innovation in Maternal Health's updated recommendations for outpatient maternal mental health care delivery.